Hey, everybody, it's Dr. T. It's been a while since I've done a live, and I wanted to come on here to basically answer questions. So what I'm going to start doing is on Sundays, I'm going to do Q&As live at 2 p.m. on Sundays, God willing, and kind of come to you and ask you if you have any questions. Now, you can ask questions about anything, health, hormones, endometriosis, fibroids, anything in women's health, from things like testosterone, progesterone, estrogen, thyroid, whatever you want. I know that everybody can't see me as a patient, and I can't really answer medical questions pertaining to your particular health problem, but I can give generalizations. I can talk about what it is that I do in my clinic. I'm currently licensed in 40 states. I have a book called the Hormone Balance Bible. You can get the book on Amazon. What I do in that book is I talk about the top 12 most common hormone imbalances in women, and I talk about how you can correct those in 6 steps, one of which is hormones, and the other 5 are things that you can do on your own. I also have a membership called the Hormone Project. You can check it out at thehormoneproject.com. That's where you have more access to me all the time. I do monthly lives in there, and I also do videos where I talk more in depth about the issues that you might have questions about. So anybody that has questions for me, if you want, you can just drop them in the chat. My office phone number is 512-956-0296. So if you have any issues that you think need addressing, or you have other more in-depth issues and personal problems that I can address in a more one-on-one, you can see me as an actual patient. So this month in the Hormone Project, I actually talk more in depth about testosterone. And I think testosterone is one of those hormones that is really misunderstood, not by you, the patient, but by the doctors and these physicians who really won't give you the hormone help that you need. And I wanted to just talk about testosterone while we're sitting here. Again, there's 10 of you here right now. If you have questions, comments, concerns about anything from the management to the hormones themselves to any specific needs or desires, please feel free to drop them in the chat. I'll answer those as I can. But testosterone is one of those hormones that, as a female in your lifespan, is always the highest circulating hormone in your body. You'd think that was estrogen, but the reality is it's actually testosterone. So to think that when that level drops, you don't need testosterone, unlike men who apparently need it, is a complete myth. You do need testosterone. You need testosterone to get rid of fatigue, to have muscle density, to protect your bones, to make you feel more driven, have desire. And when you don't have testosterone, you feel kind of meh, kind of blah. Thanks, Liz. I've stopped the nightly progesterone after a very uncomfortable pap. I bled and vaginitis, and thinning was awful. Could the progesterone be keeping the HRT from working? Progesterone is one of those hormones that, again, has a little bit of misunderstanding. The things that progesterone protects against: insomnia, irritability, anxiety. So for women that have a lot of insomnia, a lot of irritability, a lot of anxiety, testosterone can really be helpful. The problem with is testosterone or progesterone can downregulate your estrogen receptors in your body. So let's say you're on a big dose of progesterone. A lot of women are actually on too high of a dose, and they're on a very small dose of estrogen. So what happens is doctors are so horribly afraid of estrogen that they'll overdose you on progesterone and they won't give you enough estrogen. So what could happen is the progesterone could be adding to the low estrogenic effect on your vulvar tissues, thus causing you to have some discomfort with your pap smear. So what I would do is make sure that you're basically on enough estrogen to offset the progesterone. Hey, Val. Thanks for coming. If you have any questions, let me know. We're talking about everything hormones, everything women's health. If you have any questions, feel free to drop them. I said earlier, my book, The Hormone Balance Bible, you can get it on Amazon. It's about 500 pages of everything you wanted to know about hormones. Anybody that knows me knows, if anything, I'm blunt, I'm honest. I kind of just tell it like it is. I know there's a million menopause books out there, and they can all be confusing. I'm an integrative gynecologist, been doing this for 25 years, and I think I've got enough experience to pretty much answer anything that can be thrown my way. Yeah, Liz, I think that's what's happening too. Also, if the doctor on a pap smear doesn't use any lubricant, which we try not to simply because the lubricants can interfere with the cells that we collect, but sometimes we need them because it's dry. If you were dry and then the doctor literally shoved the speculum in, that can cause some tissue damage and some bleeding. I would definitely talk to your um, provider and just give them feedback if it hurts, if it made you bleed, because even if it doesn't help you, if that doctor knows that, oh my god, I made this woman bleed when I did her pap, it could make them kind of more gentle for the next woman. Doctors learn too by feedback. We may not act like we like feedback, but we learn. I do have a few 1-star reviews on Google. I've got about 750 5-star reviews, but occasionally you'll get a negative one. And it might be because maybe I'm having a bad day, things that I can correct with either billing or my staff. So we do learn from feedback. And you need to give your doctor feedback about that if you had a bad experience. Anybody that's coming in, give me a question. If you have questions about women's health and hormones, if you have any issues with any women's healthcare concerns, from surgeries to fibroids to endometriosis, feel free to drop them in the comments. Um, let me know right now and I'll try to answer those. Basically, to get back to my talk about testosterone, there's different ways to give testosterone in women. I'm not a fan of pellets or injections. I think the levels are too erratic and they go too high. Pellets and injections, in my opinion, are a massive overdose. So then what do you use? Well, I use creams, I use sublingual tablets, and I'll even use oral pills for women who don't like those other options. Unlike estrogen and some of the other hormones, testosterone is absorbed by the GI, by the lymphatic system. So it doesn't go through your liver per se, and it is absorbed in your GI tract. Um, does the loss of one ovary due to a cyst decrease your hormones? It might for a few weeks after your surgery. A lot of studies have been done. I've seen tons of patients with one ovary. In theory, the single ovary should double its production. It's like having one kidney. The other kidney will filter all the extra blood that you would need as if you had two kidneys. So you don't need both kidneys and you live your life and you do just fine. Usually that's the same for ovaries. If you lose an ovary, theoretically, it should double its production of estrogen, progesterone, because what happens is the brain just sends more signals, the ovary makes more. Now, that's not to say that you're not suffering from a hormone issue, but your hormones might be in the normal range, but maybe not high enough for you. That's why I always recommend testing. Um, Hi, Dr. Stone. I had a radical hyst 4 months ago. Should I start using testosterone and continue using progesterone? Again, can't answer your personalized medical questions. I don't know why you had a radical hysterectomy. Usually, a radical hysterectomy is reserved for cervical cancers, but maybe they did it for a uterine cancer. Testosterone can be very helpful in women that have estrogen sensitive cancers. I do use testosterone a lot, say in breast cancers, and I've used it in uterine cancers because it's not estrogen. Now, the concern with a lot of doctors is that testosterone can aromatize into estrogen. But I will tell you, in my 27 years of clinical practice, I have never seen a woman who is on testosterone replacement for a woman with a woman's dose where the estrogen aromatizes. And I work with a lot of oncologists to show this to them because I draw labs, and so they can see that the testosterone isn't converting into estrogen. Partial hysterectomy due to endometriosis. No issue with endometriosis until 3 years later. Estrogen has also increased to 350. Is this concerning? Well, I think what's concerning is you still have endometriosis symptoms. We know that a woman with endometriosis that has a hysterectomy who doesn't remove her uterus or who doesn't remove her ovaries, sorry, can have about a 50% return of the endometriosis. And that can range in the amount, in the pain, etc. However, if you had the ovaries removed, which unfortunately you didn't, then if the ovaries are removed, you have less than a 5% chance of the endometriosis returning. So chances are if the endometriosis returns, it is obviously estrogen sensitive. You do have a level that is pretty high. When you have high endometriosis, you can try, or high estrogen, you can try to decrease your levels more gently by using a supplement called calcium D-glucarate. Calcium D-glucarate will help your body void estrogen more naturally in your stool. You can increase your fiber intake. The estrogen will bind to the fiber with the calcium D-glucarate, could gently decrease your estrogen levels. Progesterone might help, although I will tell you that there have been a lot of studies done on hormone replacement in women with endo or birth control pills. It doesn't really change the outcome of the disease. So if you're having life-altering pain with the endo, you may want to consider at some point having your ovaries removed. Let's see. I reached menopause for almost 6 years now. Is there anything I can do for a higher than normal testosterone? Well, it depends on why you're having a high testosterone. You shouldn't have a high testosterone. And doctors shouldn't base this also on one lab draw. You could have been ovulating. And if you ovulate, you're going to have a high testosterone. So I don't usually just say, oh, it's a high testosterone, because it could be normal. That could be a high testosterone because it's supposed to be high. So I wouldn't necessarily just throw the baby out with the bathwater, and I would investigate why you're having high testosterone. What's the name brand of an estradiol patch? There's a lot of them. There's Climera, there's Dottie, and then there's generic. And, your pharmacy is going to probably go to the generic form just because it's cheaper for you and it's cheaper for them. If optimal hormones levels are different in everyone, the point of the labs are a lot of reasons. And it's because of what you just said, because everybody's different. And so, if I'm going to give hormone replacement, I want to track the results. The physicians that tell you it's irrelevant because levels go up and down are just being lazy. And while you may have a testosterone, say the range on a free testosterone is 0.2 to 6.4, and you're at a 3 and you feel great, that's great. I might have a woman whose level is 3, but she still feels fatigued. Why would I go up on your level and if you feel fine? And it's another piece of feedback that I get on how you're doing and what your levels are. Where do you recommend your patients apply their hormone creams? I tell my patients to put them on the side of your abdomen or your inner thighs. And if there's testosterone in your cream, I tell them to rotate the site once a week, because if you put a testosterone cream on the same spot for months, you're going to stimulate those hair follicles so they could grow more hair in that area that may look kind of weird. So I just tell you to rotate the site once a week. I also don't like cream on the arms because it can transfer to other people. But more importantly, when you have your blood drawn, if they put the needle through the cream, then the numbers are going to seem really strange. Hi, Dr. T. I'm already your patient, just stopping by to listen. Love to listen to your educational information, making a follow-up. Thank you so much. I'm glad that I'm able to help. How long does it take to see results of testosterone cream? That's a good question. It's different for everybody, but usually I would say somewhere between 2 and 4 weeks. And with testosterone, it's usually a subtle thing at first. Like you might notice you just don't have that afternoon fatigue, like you were taking naps before, and now you don't feel the need to necessarily nap all the time. And you just feel more engaged. Are progesterone capsules good? Yeah, of course they're good. I mean, progesterone capsules are the one that I usually go to start with. All the research has been done on progesterone capsules. The commercially available dosages of 100 and 200 milligrams. The only downside that I've ever seen with those is they have peanut oil in them. So some people don't respond really good to the peanut antigen, and then we'd have to compound it. Are all estradiol patches bioidentical? Yes, usually. Because all you have to do to see if a product is bioidentical is you look at it and it says estradiol. That means it's bioidentical. It's pretty easy. Going on 15 minutes. I don't like to keep people too long. Anybody new here, if you got a question about women's health, hormones, endometriosis, fibroids, pelvic pain, incontinence, let me know. Did you say the side of the abdomen for the cream? Yes, I did. I've been putting it on my inner thighs. That's okay too. Yes, you want to rotate just so you don't overstimulate. You are awesome. Well, thank you. I will tell my children that. Are birth control pills carcinogenics? Yes, they actually are. Unlike bioidentical HRT, birth control pills are ethinyl estradiol and progestin. They can be. They can increase your risks of breast cancer. Now, that being said, the interesting thing is we hand out birth control pills like crazy. But doctors are afraid of estradiol and hormone replacement because it causes cancer. But they'll give a birth control pill at the same time. I don't understand that logic. I just did a podcast, and I have a podcast already, but I have a podcast coming out Thursday of this week where I talk about the controversies with estradiol and basically destroy them in the sense that estradiol, in my belief and in the way that I look at the literature, does not cause breast cancer. It can stimulate a breast cancer cell that has an estrogen receptor on it, but it's not causative. But we do know that birth control pills, think of birth control pills and HRT as Tylenol versus Motrin. They both have similar effects, but they're completely different medications. Tylenol goes through the liver, ibuprofen goes through the kidneys. They just have different ways they work. And that's the same with birth control pills and HRT, two totally different medications. Looking forward to our visit, or my Thursday broadcast. It's coming out. I have a bunch of episodes on estradiol already. I have one on women over 65 that shows that women over 65 on estradiol have decreased rates of breast, colon, lung cancer, dementia, and they have less morbidity and mortality. Sounds like a win-win-win-win to me, but still we have this fear. What do you think about women who keep their testosterone level above range because it's where they feel best? It depends. It depends on how high it is. So let's say the range, again, free testosterone is 0.2 to 6.4 and they're at 7. Well, that's different than if it's 27. When you start getting higher and higher and higher, you start having side effects. It shifts your cholesterol to a bad cholesterol, meaning bad cholesterol goes up, good cholesterol goes down, high blood pressure, clitoromegaly, meaning the clitoris gets bigger, voice deepening, which is permanent, hair falling out. So you start having a lose situation when you go too high for an extended period of time with testosterone. If it's barely elevated, I actually don't mind that. But the way I look at it too is you might feel better. Okay. My testosterone junkies, as I jokingly call them, yes, you will feel better if your testosterone is the level of your husband's or your partner. However, you're going to pay the piper eventually. And it's not seen for a long time. It's just like, it's a bad analogy, but I use cocaine. You feel great on cocaine, and doing it for a short period of time, addiction aside, isn't necessarily going to harm you physically. But over time, high blood pressure, heart disease, same thing, stroke, it can harm you. So while you might feel good for a short period of time, eventually it's going to catch up with you. Can testosterone help prevent osteoporosis? Yes. The two hormones, in my opinion, that are good for osteoporosis, estradiol, and I talk about this in the podcast coming up on Thursday, estradiol and testosterone. There's two cells in your body that help with bones. There's osteoclasts and osteoblasts. Osteoclasts are the cells that munch up your bone. They remodel it. They get rid of old bone. They help kind of clean things out. Those are inhibited by estrogen. So the higher your estrogen levels, the less osteoclastic munching that you have on your bone. So estradiol can stop bone loss or slow it down. Testosterone stimulates a cell called an osteoblast. Osteoblasts make bone. So testosterone stimulates bone growth, estrogen slows bone loss. It's a 1-2 punch. So why women with osteopenia, osteoporosis aren't on both testosterone and estrogen blows my mind. Let's see. Lymphoma was ruled out for my breast. That's great news. Would you recommend HRT to a woman with factor V? So that great question. You get a high five. Tough answer. Factor V laden means that you have a genetic abnormality that makes your blood more likely to clot. So sitting on planes for long periods of time, surgeries, things like that, you're more likely to have what's called a DVT, or a deep venous thrombosis, which can then lead to pulmonary embolism. So you want to obviously be cognizant of that. Topical estrogen, meaning skin creams and patches, do not increase your risks. So here's the way I look at it. You live your entire life with estradiol in your body, right? And you had factor V your entire life. If you're not throwing DVTs, if you're not on blood thinners, you just know you have this mutation. So you want to make sure of all these things, like when you have surgery that you do blood thinners, if you go on long trips, things like that. Bringing you back up to a normal level in menopause with estradiol would not increase your risks past what you already had when you were younger. I have women that have factor V that are on estradiol. I want testosterone, but do not want to end up with facial hair. Testosterone, you have testosterone in your body your whole life, and you don't have facial hair, right? So most facial hair growth is probably genetic. If you look at the women older than you in your family, Italians, people with dark hair like me, those women may have more chin hairs, nasolabial hair, things like that, but it's probably genetic. Now, if you use testosterone, it's going to stimulate your hair follicles around your body. It's going to make the hair in your head grow too. But if you keep it in range for a female, you shouldn't have any more hair growth than you would have had in your 20s or 30s. But if you're overdosed on a pellet or an injection, or they got you on a cream that is a massive dose, you might grow hair where you don't want it. So just make sure that your levels are normal. Have you looked into the research on oral estradiol being more beneficial for cardiac health? I don't think that's necessarily true. I don't know the particular study you're referencing. Be more than happy to look at it if you have a link to it. But estradiol in general is beneficial for heart, because women, when they go through menopause, if they don't use hormone replacement, have the same risk of heart disease as men. And that's because of the loss of estradiol. Estradiol raises good cholesterol, lowers bad cholesterol and triglycerides, so it can help prevent heart disease. And as we know, heart disease is still the #1 killer of women overall. I'm not aware personally of oral estradiol being more beneficial than topical estradiol. I do take patients from Indiana. I'm licensed in 40 states. If you want to know the states I'm licensed in, I don't want to bug everybody here. If you go to my Instagram page, Sean Tasson MD, and look at my second pinned post that has a picture of the United States, it has a listing of all the states. Don't look at the photo, look at the words down below. I have all the states there where I'm licensed, and I am licensed in Indiana. Oh, thank you, Carrie. That's very nice. I'm going to do these Q&As every Sunday now at 2:00, because I think it's helpful. And there's a lot of misinformation out there. There's a lot of confusion out there. I'm not Hormone Jesus. I would like to think I'm Hormone Jesus, but I'm not. I'm learning. I think I have a lot of experience, and I know a lot of things that maybe some of the other docs don't know, especially the dabblers that work at med spas and whatnot. But I'm also trying to educate you so that you have the right questions and you get the answers that you want. Yeah, everybody, like Denise says, press the thumbs up before you go. Wake me up before you go. I was just thinking the other day, this is totally off topic. But does anybody remember, thinking of that wake me up before you go, George Michael passed away at a very young age, a couple of days or a day after Michael Jackson, and he didn't hardly get any press. Poor guy. I mean, what an amazing artist, and because he was eclipsed by Michael Jackson's death, didn't get any press. I feel really bad about that. Talented guy. Will increasing your estradiol help a hypertonic bladder? So by hypertonic bladder, I assume you mean that you're having like irritable bladder where you feel like you have to urinate all the time, and maybe you do and maybe you don't. Yes, it can. One of the signs of menopause for a lot of women is that irritable bladder, because the bladder has a lot of estrogen receptors. All the cells in your body do, but the bladder specifically. And using estradiol can decrease the times you wake up in the middle of the night for bladder issues. It can also help some women with stress urinary incontinence, where you cough, sneeze, especially if it gets worse in menopause. Going on a little bit of estradiol can sometimes make that better. Yeah, Farrah Fawcett. Man, Farrah Fawcett, Charlie's Angels. Whew, when I was in junior high, I had the poster, with the one piece bathing suit and the hair everywhere. I mean, come on, seriously. Do you recommend that women get a total hysterectomy? They should have a sling. I used to do slings all the time when I was younger and doing a lot more surgery and wasn't doing hormones as much. Slings can be very helpful. Slings are difficult because they are a foreign material. You want to make sure that you get them put in by a doctor that's done a bunch, because they can be too tight. They can cause urinary retention. They can erode into the vagina or the bladder. So as long as you're getting your evaluation done by somebody that actually knows what they're doing, I would definitely proceed if you're having a lot of incontinence issues. Um, do you recommend that women get a total hysterectomy? Oh, that's the sling question. I mean, I would only do the sling if you felt like you needed it. And how do you know you need it? Well, if you are wearing a pad all the time, if you can't live the life you want to live because you're, leaking all the time and it's irritating to you and it pervades your thoughts 24/7 and it alters the way that you live your life, then yeah, if you're already having surgery, you might want to consider that. Your ex-husband. See, I'm an ex-husband too. So maybe there's a common thread there. I'm getting ready to do a follow-up with you. My thyroid antibodies are 400 points less than initially. I'm impressed with you. I'm going to tell my ex-wife that. I'm just kidding. Here's the thing. People with Hashimoto's thyroiditis, where your antibodies are high, a lot of doctors, first of all, won't treat it. They won't, they just will be like, oh, there's nothing I'm going to do. And this happens especially with endocrinologists. But the higher your antibody numbers usually means there's more inflammation in your body. There's more antibodies attacking your thyroid. Low dose naltrexone can decrease those thyroid antibodies significantly, which means less inflammation for you, which means the endogenous production of your thyroid hormones might actually be better. So I'm glad. And it can mean you have less inflammation throughout your body. Low dose naltrexone also curbs appetite and can help with weight loss. There's a lot of good benefits to it. So I'm glad you're having some great results. How do you feel about women getting ultrasounds over MRI on their breasts? Wow, that's a tough question. Our system is currently set up for a mammogram, if the mammogram's abnormal, a focused mammogram, and an ultrasound. The reason we don't go to MRI first, even though MRI is a better visual look at your breasts, it's cost. If every woman got an MRI, the cost to the healthcare system would be in the billions. It's a great test. It's hard for a lot of women because you're in that little cocoon. It is a great test though for breast tissue, but the mammogram and the ultrasound are also great. I'm adding thermography to my clinic simply because mammograms with thermographies are actually great combo 1-2 punch to look at breast tissue. But the short question is, yeah, or the short answer is yes, MRI is better than ultrasound. My doctor just ignored me. You put me on LDN. I'm a nurse. I didn't even know about it. You know, I'll be honest, I didn't know about it 7 years ago. It's a learning process and it's new. For those of you with Hashimoto's thyroiditis, I do talk about it in my book, The Hormone Balance Bible, but there's a better book out there called Hashimoto's Protocol. And there's another book called The Root Cause, both by Isabella Wentz, Wentz. She's a great friend of mine. She lives here in Austin. She's a pharmacist. She's an amazing human. And it's more about Hashimoto's than you'd ever want to know. So I would definitely recommend getting her book. Oh, I skipped somebody's question. Well, I didn't see it. I'm on estradiol patch, postmenopause, 2 times a week. When is the best time to check blood levels? That is also a great question. So if you put the patch on and then you all of a sudden get your blood drawn like that day or the next day, your levels are definitely going to look higher than the 4th day because the patch is starting to wear off. Now, you can get hung up in the weeds on this stuff and get super picky about it. But what I tend to do, because I've been doing this for so long, is I just ask the woman, one, how she's feeling, and two, when did she put the patch on? For me, I just know what levels should be around and I just do it. So I would definitely see a doctor that knows what they're doing. But that being said, if your levels are super high on day 4, then that means your patch dose might be too high. Again, if you're having symptoms, like you're on day 3 or 4 and you're having hot flashes and your levels are low, then you might be on the high side. The progesterone cream did help me sleep. I became depressed and really sluggish in the mornings. So it could just be you're on too high of a dose. Easy enough to come down on that. When to draw labs. If a woman is irregular cycling some months, should you check it on? I'd never check hormones on day 3. That's irrelevant. Day 3, everything is low. So what's the point? Because you're supposed to be low. I try to check on days 19 through 21-ish. But if you're irregular, again, I don't make women wait to draw their labs if they're miserable, if they're having irregular periods. Again, if you have a doctor that knows what they're doing and you do your labs, you can combine it with symptoms and numbers to just kind of piece together parts of the puzzle. It's also going to matter over time. So if you stay with that physician, then, and they know what they're doing, they can start putting the puzzle together with you over the follow-ups and things like that. Yes, a warm bath, saunas, being outside in the heat where it's exposed can make the patch release at irregular rates. So if you have a patch, you got to be careful. If you're somebody that saunas all the time, like I do, I'm not on estrogen, but I sauna probably 5-6 days a week. You might want to use a different form, like a sublingual or even a capsule. Wow. You guys are asking great questions, and this has gone 30 minutes. I was thinking it would be like 10 minutes. I don't want to make this super long. I really appreciate the questions. And if you don't follow me on Instagram. I do Q&As every Saturday. I'm going to start doing these lives every Sunday. You rock. Thank you, Rose. That's amazing. That's very nice of you. I have a great doctor to give great advice. Thank you for your time. You're extremely welcome. I'm going to end the live stream here. Follow me on Instagram. Follow me on Facebook. Get the book, The Hormone Balance Bible. I'm licensed in 40 states. More than happy to help you. Have a good rest of your Sunday, everybody.